So when we look at children that have symptoms of inattention or hyperactivity or any type of obsessive compulsive or motor tics or even Tourette's, social pragmatic type of problems where they have social communication issue, or as they age up, they don't necessarily have what we call pragmatic language, or the conversational aspect of language. They may actually speak and use vocabulary and spell really well because of the bias of the left brain. But in terms of understanding language or comprehending language, which is a primary skill of the right brain. So what happens in all these disorders is that we see these retained primitive reflexes. Now, the severity of the brain imbalance, the severity of the difference between the development of one hemisphere to the other is probably also going to indicate the severity of the primitive reflexes. Okay, if the primitive reflexes are really severe, then the immaturity in the brain is going to be really great. Okay, and now what we'll see in a lot of children is that they'll be blessed because of some of the hemispheric traits that are actually passed on by family members that allow them to have an acceleration of one side versus the other. This is why we really believe that autism is what we refer to as like a geek syndrome, okay? That we see these very exceptional left hemispheric bias skills, even in all the non-speakers that Dr. Malone and I are working with right now. They all have these tremendous left brain skills that we're actually seeing from them. And so that would be number one, is the retention of the primitive reflexes. Number two would be muscle tone. Okay, most of these children actually have various hypotonia. Some of them have global hypotonia, low muscle tone globally, but then we'll see patterns of this muscle tone, mostly in posterior compartments of the muscle system. Okay, and then thirdly, I would look at the vestibular system. Okay, and looking at how they have aberrancies in vestibular output from both vestibular systems. Either they may have, in most instances, hypoactivation of the vestibular system, low output of their vestibular functionality. Some children will have hyper, but the majority of kids will have hypo. And fourth, we would look at a lot of the oculomotor development of their eye muscles, okay, inability to have coordinated eye muscles in basic eye tracking or rapid eye movements, or the ability to converge or diverge their eyes. So broadly speaking, I would say those four major areas we're going to see are going to be delayed. And then as they begin to, let's say, develop the 2 and 3 and 4, when we should see more of their cognition developing, their cognitive powers developing, or their social pragmatic development happening around that, let's say 28 months, beyond the 36 months, the 50 months, that's when we'll start seeing that delay in those functions as these kids are entering into, let's say, preschool, pre-K. But you're going to see the primitive reflexes, the low muscle tone, the hypovestibular function, the failure of eye muscle tracking. I mean, those things are definitely going to be seen below 36 months of life.
Rob, I know you need to go in a few minutes.